side, right? But there's no way all the doctors and nurses attending to your loved one could ever know what you know about that individual. You are the expert of the individual. It really takes teamwork of both of you to bring that together. And what is typical is that the medical profession just takes over. And the medical system just takes over. And here you are, the expert on the person, and you're more like the observer, like the outsider, as you watch this medical mechanism just grind its way forward. And just to slow it down takes all the energy you have as a patient advocate, with all the emotions that are going on inside of you, to say, hey, wait a minute, stop the train. What decisions are you making about my loved one and why? What are the alternatives? Just to get someone to sit down and go through that with you is a Herculean effort a lot of times. Not always. Some doctors are more sensitive to that. But often, just to grab one and say, wait a minute, I don't even know what's going on. This whole medical apparatus is moving along and making decisions and ordering tests, and I don't even know what's going on. I don't know that my mom ever wanted this kind of testing or this kind of procedure. Let me give you a case in point. My mom died in October of 2012. In April of 2012, she was in the hospital with another urinary tract infection, which is a reoccurring infection of older adults. And by the way, as a patient advocate, you would better learn what their preference is for antibiotic treatment. You always talk about CPR, ventilation, kidney dialysis, but what about antibiotic treatment? It seems like a no-brainer. Oh, he or she's got an infection, let's throw an antibiotic in it. But when you see that revolving door happening over and over with less time in between home to hospital to nursing home, to home to hospital to nursing home, or nursing home to hospital, nursing home to hospital, when you see that revolving door and it's happening faster and faster, there's got to be a point in time which you ask yourself, is this worth it? Does my mom or dad or husband or wife or son or daughter, whoever it is, do they really want to be put through all of this, especially if they can't speak for themselves? And that is one of the toughest calls of a patient advocate, when to stop that. Because you know what the nursing home's going to do. They're going to send the patient to the hospital. That's their mandate.
In fact, Sue, that's what my question was. They were treating my sister-in-law with antibiotics because of her stomach, and I asked the doctor if there was an alternative to antibiotics. My experience has been when you're taking antibiotics, it's good to take a probiotic as well.
Right.
To bring back all the
right, because you're wiping
bacteria.
out all the good bacteria
Right.
in your intestine. Yeah, right. So here's what happened in April of 2012. My mom had a UTI. She also had, she was losing her breath. She was just sitting there in the wheelchair, and she'd have these panting spells, and it scared the crap out of her. What was happening was her heart was racing both too fast and too slow. She had both conditions. More often than not, you have one or the other, but she had both. So they wanted to put her on medication to regulate the slow one, and they wanted to put a pacemaker to regulate the fast one. My mom by then is 90 years old, and she had been through this medical maze for, this is her 22nd year. Can you imagine how tired she was? Her soul, and I knew this, her soul was ready. What the doctor never explained, and by great fortune, 2 months prior to that moment, 2 articles had come across my desk. As I said, I do a lot of reading. And in the 20 years or so I've been at it by then as a professional, I'd never encountered this situation. And there were 2 articles that popped up at the same time on my desk 2 months before this question came about my mom. And it was about a pacemaker in an older adult. And both articles were about the caregivers that went along with what the doctor said. The heart beats pacemaker, so I guess we'll have a pacemaker. What the doctor never explained, perhaps just never thought to explain, was that the pacemaker kept those two patients who had advanced dementia alive long after their awareness had already gone down the toilet. And so now the family was burdened financially and emotionally with keeping this body alive. Not keeping it alive, caregiving the body that was kept alive by the pacemaker, right?
Yeah.
So these are the things, as patient advocate, you need to think about, and you need to question the other side of the story. The doctor may never tell you, well, in this patient, it's really not the best idea. Understand that unfortunately, the whole medical apparatus is geared toward profit. I mean, and sometimes it's done callously, and sometimes it's done just matter of fact, that's the way it is. Because it is a business. The hospital has to stay open to help anybody. So it can be a good thing, but it can also be very, very unproductive in your particular case. Go ahead.
Your mother didn't have a, I don't know, they call it a living will, or?
She did.
She did.
She did.
Oh.
But see, in that moment, as the doctor was presenting it, he's not looking at her living will. And I knew what she wanted, and I would have guessed my mom would have declined that, which she did. But the doctor doesn't enter into that discussion.
Oh.
They enter into the medical necessity discussion.
My daughter was 43 when she died. She was at church. She had a massive attack, and she died at home that afternoon. And I knew that she didn't want CPR. She didn't want anything. She had a lot of health issues. She had multiple disabilities. The ambulance came because I had them call, and they came and they wanted to, so why did you fill this out? I had a page full of all her medical stuff, all the history on one page. They looked and they said, who wrote this? I said, I did. They threw it out. It didn't matter. I was the parent. But because I didn't have my durable power of attorney
Yes.
and all of that right
Yes.
there then,
Right.
it was down the basement, but when somebody dies suddenly in
Of
your lap,
course.
you don't know.
You're in the heat of the moment. You don't think
So
about
they
all
wouldn't
these
take
things.
my word for nothing.
Okay.
For an hour, they did a CPR,
Good point.
They cut her throat, they did
Yeah.
the whole thing, trying to revive her. Anyway, I was going nuts.
Oh,
Got
yes.
to the hospital, and finally the nurse said to me, you don't want it? And I said, no, I told you, call the doctor. The doctor will prove that I'm, telling the truth.
Okay.
And they did, and they got it handled, but
I'm so sorry to know that. First of all, I never knew you had lost your daughter.
Yeah,
And that's a moment you'll never forget.
you're right.
But Marge raises an excellent point. You all have heard of a DNR. You always sign one in a hospital or in a nursing home if that's your wish. But what you may not know is that you can have a privately drafted one. It's done by Michigan statute. There's very particular language that's needed. It's just one page. It's signed by you and your doctor. And you put that on your wall wherever you live. And it's that one page. It's like a mini version of a patient advocate designation, but it's just one paragraph, on one page. Very simple. Put it on your wall. And that's what takes effect outside of a hospital or a nursing home. That's the document you want.
What is that called, that form?
I call it a outside the hospital DNR.
Okay.
Do not resuscitate.
But you need it in your wallet if you don't have a wall or anything. You need it in your wallet. You need it with you at all times.
Or better yet, I would put it on a bracelet
Or something.
and say DNR, see wallet, something like that.
Yeah.
So it's very, very obvious. Because those EMS people come in and they just move.
Yeah,
Well, they're supposed to save people, that's their training, right?
That's right.
yeah.
Okay. Demand answers. I'll give you a tool. It's called the shadow technique. You know when you ask a doctor or nurse a question and you're getting kind of a generalized, unsatisfactory answer, and then they move on. I learned. I mean, it's so hard to know how to get answers out of a fast-moving machine. And so what I do is I learned to be, and this is on your sheet somewhere, the rule of 4 Ps: a patient, polite, persistent, pit bull. That's the key. And so I didn't say anything. What I did was I shadowed the nurse down the hall. I just walked behind her. And all that unspoken behavior let her know I wasn't satisfied with that answer. I didn't have to be mean. I didn't have to be nasty. I didn't have to do any of those things. I just communicated through my body language that I wanted a better answer. So, it's hard. It's hard in these moments to grab someone who is racing down the hall to attend to another patient. But you're the patient advocate for your loved one. You have to have this information. And so it takes a certain level of putting yourself out there. And that may be way out of your comfort zone. But that's what's required of you as a patient advocate. There was another instance where I was at a nursing unit, and there were had to be 10 people between nurses and doctors just doing their thing in the nursing unit. And I stood there, and no one would look up to me. It's I'm not standing here to be a pillar in the hallway. And so finally, I kind of laughed, and I said, I know someone sees me. And then they all stopped what they were doing, and they looked at me. And so I was trying to inject a little humor into the situation to try and cut through that institutional stuff again. Because that's what you're always doing, cutting through the institutional stuff, the system stuff. And that's hard. Let me give you another example of asking questions. Patient advocate has an absolute right to see the medical chart in the hospital while the patient is there. You will invariably be told, well, you can get a copy of it upon discharge. No, I don't want a copy of it upon discharge. I have to make decisions now. I need that information now. Well, I'm sorry, you can't see it. Yes, I can. I know the HIPAA law, the privacy law. HIPAA is short for Health Insurance Portability Authority Act or something like that. HIPAA, HIPAA. It's the privacy law. You get notices in your mailbox every day about HIPAA. And the hospitals are terrified about breaching HIPAA. And so I say, well, I happen to be an attorney, and I happen to be an elder law attorney, and I happen to know about HIPAA. I have a 3-ring binder that thick of the HIPAA law at my office. And there's nothing in there that says I can't see the patient chart. Well, they're not on paper anymore. They're all in the computer. So it's a little harder. But anyway, at this time it was on paper. And the nurse said to me, well, I can't show it to you. You're going to have to ask a doctor. Well, I knew that was BS, but I'm at low. My battery's at low. This is a very emotional time. So day 2 residents walk in. They're both doctors. I said, oh, you're doctors. I want to see the chart. What do you think they told me?
No.
Nothing.
No, you have to ask the attending physician. The attending physician is the quarterback, the team quarterback of the whole medical team, right? I said, now, no attending physician in this hospital or any hospital is going to have time to sit with me in an hour as I flip through the pages of the medical chart. But being on low batteries, I said, okay, day 3 rolls around. I call the attending. He really tries. He really tries. He is very sincere. But I knew it was going to happen. I sat in my mom's room for 3 hours. 3 hours later, I get the phone call. I just can't move. I said, I knew that. I knew that this was going to happen. I just didn't have the energy to fight it. Well, now I'm pissed. I am really fueled through the anger that will often happen to you as patient advocate. You just get angry. You get so frustrated at this system that is not responding to your individual needs. And so I march myself right down to the chief legal officer's office, the head honcho in the legal department. And I go down there, I put my hands on my hips, and I gave him the whole speech. And he said, you're absolutely right. Go back to the unit and ask a nurse to sit down with you, which is where I started on day 1. I said, I knew that. Do you think the story ended there?
Mm-mm.
What do you think happened?
They're such clean, started over again.
Shifts change.
That's right.
You have a whole new cast of characters.
You gotta start all over again.
Went through the same BS again. But I took the legal business card of the head honcho. I said, you call him and you ask him if I can see this chart. And so I had learned a way to short circuit the system again. And you're forever going to have to find ways to do that. Does that make sense to you?
What hospital was that?
It was Beaumont Royal Oak.
Oh.
Okay? So ask questions, demand answers. V, voice your loved one's wishes. It is not your job to do what you think is right. That is not your job. Your job is to do what your loved one wants. Let me give you an example. At the end of life, when my mom was in the hospice unit at the hospital, I am with my two older brothers. I am the patient advocate. I'm the one that has legal authority to make the final decision. I have walked with my mom every day for 22 years. My Denver brother, Nelson, comes in. He wants mom to have a blood transfusion. I knew this is not what she wanted. And yet he's very adamant about this. So there we sit, me and my two older brothers in this conference room. And this is where I start the book. We have a blow up. I listen to them debate. They're two engineers. That's how they're debating this, like a broken part in the machine. And I listened for 10 minutes, and I couldn't take it anymore. My emotions just totally took over. And I started pounding on the table, and I yelled so loud the nurses were ready to call the security force. I mean, this is how strong but that was my job, was to voice her wishes, not my brother's. And I was in the worst position you could imagine. If I say no to him, I'm saying no to him in his most utterly painful moment of his life. And I'm saying no. Your opinion doesn't count. What a horrible spot to be in. If I say no to my mom's wishes, I know she will haunt me after she dies. And I do what she wants. And that's where the book starts, is this big blow up. But it was my job to voice Violet's wishes. That's your job. Do you all really get that? It's not about what you want or what you think is best. You must sit down with your loved one and ask him or her what they want. That's your job. Okay? Oh, observe. Observe what's going on. Observe the doctors and nurses coming in. Ask them questions. Get a paper and pencil. Write down their names and what they're saying. Because oftentimes one specialist comes in, they're not talking to the other specialists, and they're telling you things that are inconsistent. This should be done. No, that shouldn't be done. This should be done. And they, and there you are. You're not a doctor. And how are you supposed to make sense out of all of this? And so you take notes, because you're never going to remember all that they say. You must take notes. You observe, you take notes. Whenever you go to a hospital, you better be taking a tablet with you. Or in my case, I'm not techno, but I have this lovely iPad. And I can type on my iPad. So I break that out and type on my iPad. Because I could not remember all the names and what they said. Okay? That is fundamental as a patient advocate. You must observe and you must ask questions, you must demand answers, and you must take notes. This is your job. Okay? All right. C. What do I have under C?
Communicate your findings.
Communicate. Communicate. Communication breakdowns. I gave you one example of communication breakdown, right, at the nursing home with a blood thinner. And it could have killed her. Here's another one. This is when she's in hospice. She's in assisted living. I bring hospice into assisted living. This is the week she starts getting sick that precipitated the whole 27-day last fling. And hospice is in there. They are communicating to the facility nurse as to what her medication's on. I am assuming, which is, always a red flag word, but I see them physically talking to each other. I am not micromanaging them. I am assuming they are both doing their medical jobs, right? Little did I know that all they talked about were her medications. So 2 days into her sickness, she's not eating, she's diabetic. What happens if you don't eat and you're diabetic? Your blood sugar goes down, right? Do you think the hospice nurse was communicating that to the facility, or the facility nurse had any presence of mind to see that this was happening? Or even to find out more information about Violet because she's really, really sick? None of that happened. She kept getting her diabetic medication, which further drove down her sugar. So one night my brother calls me at 7:30. He came there after work. I'd been there all day. As sick as my mom was, she was at least somewhat responsive. He's calling me and saying Mom's unresponsive. So I rush up there, I see her, she's nearly comatose. And thank God, again, I had the experience I did, because any less informed patient advocate would not have known what to do. I take her blood sugar, it's down to 65. Should be 120. I am now in this totally untenable position with her limp head in my arm, hoping she is responsive enough to swallow the sugar when I put the sugar in her mouth and tell her to swallow it. If she's not, I have the decision whether to take her to emergency, which she does not want to go to, or let her die in my arms. And that was the moment I was in hospice. This should never have happened. Never have happened. I was in the worst position imaginable. Thank God she was with it barely enough to swallow the sugar. I saved her life that night. She would not have made it that night. What difference would it have made that I bought 2 weeks of life for her? It allowed my Denver brother to come in and be with her. That's enormous.
Right.
So I'm saving her life in hospice. It's just totally nuts. Totally crazy. Now, I read the riot act to the facility nurse and the hospice nurse. I mean, I really let them have it. 2 days later, she's not getting any better. I don't know what to do. I call my cousin's wife in, who's a nurse at a nursing home. She comes in, takes her temperature. Her temperature is 104. My mother is suffering. Was anybody ever taking her temperature? No. No one was ever monitoring her vitals. And this is in hospice, where I assumed all of these details were being attended to. I said, that's it. I can't take it anymore. I cannot babysit the medical profession. I pulled her out of assisted living, which is where she wanted to be, put her in the hospital hospice, gold standard care. Couldn't have been better. So I had from the absolute worst of hospice to the absolute best, all within 1 week. There is a lot to know about picking a hospice, but I'm on A. What's A? I don't remember.
Consider posture.
The second A.
Oh, the second name?
Oh, assertiveness. That's the rule of 4 Ps, the pit bull one. We've done that. T, take notes. Yep. We talked about that. E, educate yourself. That's self-evident, right? Self-evident. Okay. So we're moving along in this medical maze. Oh, these are extras.